Hi guys, Dr. Vic Bhatia here. With me is our registered dental hygienist, Ms. Karen Luna. We're going to talk a little bit about periodontal disease. Periodontal disease, as fancy as it sounds, some of you all may know as gum disease, bleeding gums, deep pockets, and a lot of times patients are aware of what's going on, but again, as Ms. Luna mentioned earlier, ignorance is bliss, and that's not the case. And it's a silent disease, it's an insidious disease, leads to tooth loss. But what we're finding out more and more is heart disease, Alzheimer's related to that. Recently I was in a conference and they said they were looking at patients who have passed away from a heart attack and dissecting and looking at a cellular level of their heart tissue, and what do they find? P. gingivalis, same bacteria that's in your mouth causing the gum disease, the bleeding, and the periodontal disease. Today we're talking about a very safe FDA-approved appliance called PerioProtect and a delivery method that works really well. And I'm going to let Ms. Karen Luna take away from here and kind of tell our patients, our audience, as to what PerioProtect is and how does it work.
So PerioProtect, like Dr. Vic stated, is the only FDA-approved appliance used for treating periodontal disease and gingivitis. So what it is, PerioProtect trays are clear trays that you wear top and bottom, and basically they're a delivery system to deliver hydrogen peroxide gel, which can be titrated with an antibiotic. And this will deliver the medication down into the base of the gum pockets, however deep the gums are, to oxidize and eradicate all of the bacteria. So doing this for 15 minutes a day, about 7 days a week, 5 or less complicated cases, will oxidize the bacteria down to the point where we don't have bleeding, we don't have deeper pockets, and we can get our patients to a healthy base.
Thank you, Karen. And going back to what you talked about, the 5mm pockets, sometimes I get patients that have no pocketing and then their gums are bleeding, and we have no idea why. All it is this inflammation needs to be tackled with. So again, why I like this system: A, it's affordable. You're not coming in that much to our office. I truly realize people don't have enough time to come to the dentist. No one wakes up and says, yay, I gotta go to the dentist. So this is basically a delivery system you use at home. In the past, we were using Arestin, a very expensive antibiotic. You've got to come in, we've got to deliver it. Works well, but what we're trying to find is ways of minimizing the patients having to come in the office, and a system that truly works. And this is a lot more affordable than traditional antibiotics that we place in the gum pockets.
Oh yeah, it sure is.
And Luna, if you don't mind talking a little bit about the cost and how long can it last?
So the initial cost is under $1,000, which is great considering all of the benefits and you being able to use it at home. It's just under $1,000 after you run out of the gel, which it varies per case. Each tube is $25.
And that's, in my opinion, I know dentistry is expensive. Some of you are watching this is like, oh God, a little bit under $1,000. But imagine now you've had an implant, you've had crowns, you've had cosmetic work, and you have bleeding gums, and that fails that dentistry. So I'm on the restorative side. I remove old implants that have failed and replace them. So this is something that we can educate you more, give you more literature on it, let you touch and feel, or you can go to PerioProtect's website and get educated. Looking forward to serving you. Thank you so much, Ms. Luna, for talking to our audience. Appreciate it.